Well, good evening, everyone, and thank you for joining us for tonight's Fireside Chat on COVID-19 vaccines and rural communities. I'm Dr. Mandy Cohen. I'm Secretary of the North Carolina Department of Health and Human Services, and I want to thank you all for joining us for this really important dialogue. I'm really excited that tonight's Fireside Chat includes a telephone town hall feature as well. And you'll see there's a telephone number on the screen that you can dial to submit and have your questions answered live during tonight's Fireside Chat. So that's exciting. We'd like to thank everyone who sent in questions in advance of tonight's event. And for others who have questions, we encourage you to submit them through the phone line, or you can also submit them through social media, however you are viewing this event tonight. If you're joining us by phone and have a question for our speakers, just press 0 on your phone keypad at any time to be added to the queue. So that's to press 0 if you're on the phone to get added to the queue. And we'll try to answer as many questions as possible through the hour. We hope this feature will help ensure that everyone can access this important conversation. So as we dive in, I want to remind folks that we've made really great progress in vaccinated North Carolinians. More than 52% of adults who are over the age of 18 have received at least one dose of the COVID-19 vaccine, but we want everyone 12 years and older to get the COVID-19 vaccine, and we know we have more work to do. Now, there's been a lot of updates recently, and I want to make sure everyone has the latest information. For one, the Pfizer vaccine was recently authorized by the FDA for our children ages 12 to 15-year-old to be able to get vaccinated. That means now everyone in North Carolina over the age of 12 is eligible for a safe and effective COVID-19 vaccine. So that's great. Second, you also likely know that the governor and I also recently updated our mask requirements based on some new guidance from the Centers for Disease Control, or the CDC. And we took that step to take away the mask requirements and other social distancing requirements because the science shows that our focus on getting people vaccinated is working. Our cases are at their lowest points that we've seen in quite some time. Our hospitalizations are low. It shows us that vaccines are working, and we want to make sure everyone has access to a vaccine to protect them and their communities. We know that we still need to make more progress, and we need more people to get vaccinated. And the best way for all of us to safely get back to the people and places we love is vaccines. The faster people get vaccinated, the sooner we can slow the spread of COVID-19 and put this pandemic in our rearview mirror permanently. We know some people want more information, and that's exactly what tonight is about. I'm excited to be joined by several wonderful guests to help address your questions, to better understand and remove barriers that exist within all of our communities, and to ensure that everyone has the information and access they need to get a safe, effective, and free vaccine. So tonight, I am honored to be joined by our two featured guests. First, Patrick Woody, who is president of the North Carolina Rural Center, and Bishop Paul Leland, who is the resident bishop of the Western North Carolina Conference of the United Methodist Church. And we're also joined by Kelly Clabria, president and CEO of the Foundation for Healthcare Leadership and Innovation, who's going to be moderating tonight's discussion. I am so grateful to the three of you for being here tonight. And so with that, I'm going to turn it over to our guests to introduce themselves and to share some remarks of their own. So we'll start with Mr. Woody. Would you like to kick us off?
Thank you, Secretary Cohen. It's a pleasure to be with everyone tonight. I look forward to our conversation over the next hour. My name is Patrick Woody. I'm president of the North Carolina Rural Center. The Rural Center is a private nonprofit. We are now in our 34th year, so we've been doing this work for a while. We serve the state's rural communities, and we look at our rural communities and really think about rural communities through an economic development lens. Our mission is really to improve the quality of life of the state's rural citizens and of the rural communities that they call home. And that's what we've done for over 3 decades now. We're based in Raleigh, but we serve 80 of the state's 100 counties, about 80% of the landmass of the state of North Carolina. And those 80 rural counties all have population densities well under 250 people per square mile. Just to remind everybody that we live in a state that is rapidly changing, one of the most rapidly growing states in the country. And in spite of all that, we remain a really persistently rural state. We have the second largest rural population of any state in the country. Only Texas has more rural people than North Carolina. And only Pennsylvania has more small town people than North Carolina. We have the second largest number of small towns with under 10,000 population of any state in the country. COVID has changed every aspect of life as we know it for urban, suburban, and rural people. And certainly it has not spared rural North Carolina in its impacts. It's changed every aspect of life as we know it, working, shopping, learning, how we access healthcare, how we go to the doctor, how we worship, how we celebrate, how we mourn. All of it has changed. And I look forward to talking with you about the impacts and what we see on the other side of this. It's my pleasure now to turn it over to Bishop Paul Leland.
Thank you, Patrick. Good evening, everyone. I'm Bishop Paul Leland, the resident bishop of the Western North Carolina Conference of the United Methodist Church. After being ordained, I've spent most of my ministry in Eastern North Carolina, and I'm currently serving in the Western North Carolina Conference. And between those two conferences, the state of North Carolina is covered by about 2,000 United Methodist congregations, most of which are in rural areas. But having served across the state, I'm familiar with rural North Carolina, and I'm participating in the Fireside Chat this evening because of my interest in rural North Carolina and research findings from the 2021 Religious Diversity and Vaccine Survey by Robert Jones and Eboo Patel. This survey piqued my interest after it was shared with me by Reverend Rob Webb, director of the Rural Church Division of the Duke Endowment, because the findings confirm the positive influence of faith-based approaches to COVID-19. And what caught my attention was the statement made by Eboo Patel when he said, we do not get to herd immunity without dealing with faith identity. Religious engagement is key to ending the virus. And when I read that statement, religious engagement is key to ending the virus, then I began to take a closer look at the relationship and the partnership that our churches were having within the counties that they serve. So now I'll turn it over to Kelly Calabria and let her share a little bit more about herself.
Thank you, Bishop Leland. I really appreciate that, and I appreciate the opportunity to be with all of you this evening. My name is Kelly Clabria. I am the president and CEO of the Foundation for Health Leadership and Innovation, and we are an organization like Patrick's that focuses on rural North Carolina and marginalized populations, working to improve a person's whole health across the state. And one thing at FHLI that we do believe is in the importance of making connections and facilitating conversations to help elevate all voices. And so that's one of the reasons I'm really honored and humbled to be with you tonight to join this discussion as the moderator, as we aim to address any questions or concerns that you as viewers have related to COVID-19 and the vaccine. So with that, if it's good with all of our participants, let's dive in and start this conversation. And I want to say before I kick off the discussion, we want to hear from you, the viewers watching and listening out there on social media and on the phone. So we have a poll question, and we're going to encourage you to submit your response to the question. So we're going to share that question now so everyone can see it. And here's the question. If you haven't already, do you plan to get the COVID-19 vaccine? So please take a minute and answer the question. If you're joining by phone, you can use your keypad to answer. You can press 1 if you plan to get vaccinated against COVID-19. Press 2 if you're not quite sure yet. 3 if you do not plan to get vaccinated. And 4 if you still have questions and feel like you need to know more before deciding if you want to get the vaccine. And then for those of you watching on social media, feel free to type your answer in the comment section. And we'll come back to those a little later this evening to see your responses and talk about them as a group. Thank you for taking a few minutes to do that. So now I'd like to begin our discussion by asking our speakers some questions. And Secretary Cohen, I'd love to start with you. And I'd love to begin by asking, can you share with us who is eligible to get vaccinated now and what vaccines are children aged 12 and older able to get? I know you addressed it briefly in your comments as we started, but as you said, things are constantly changing. So let's level set a little bit on who's eligible.
Yeah, what a great place to start, because things have changed so quickly with vaccinations. I think folks heard early on this year there wasn't enough vaccine. It was really hard to get an appointment. Maybe not everyone was eligible. That's not the case anymore. We have plenty of supply of vaccines. So now everyone over the age of 18 can get any one of the 3 authorized vaccines. So anyone over 18 can get the Pfizer vaccine, the Moderna vaccine, or the 1-dose Johnson & Johnson vaccine, all 3 vaccines for everyone over the age of 18. For those who are ages 12 to 17, they can get the Pfizer vaccine, which is a 2-dose vaccine. So you need to go to a vaccine provider that is for if you are 12 to 17 who has Pfizer. And you can do that by going to myspot.nc.gov. There's a tool there. You can put in your zip code and you'll have to filter for Pfizer specifically. You can also call, we have a hotline, 888-675-4567, and they can help you find Pfizer specific vaccine providers. Again, that's just for our 12 to 17-year-olds. Everyone over 18 can go to any provider, get any vaccine, and I would encourage you, get the first vaccine that is offered to you. They're all safe and effective. I'm sure we'll get into that more. And I want to remind everyone, they're free. The vaccines are free, no co-pays, no payment for the vaccines themselves. They are free to all North Carolinians.
Wonderful. Thank you for that. And let me follow up with you briefly with a follow-up question, Dr. Cohen. What is the department doing to get the word out to help inform people about vaccinations and to provide access, especially in rural communities? That's really where we want to focus tonight. Can you share a little bit with how the department is really leading on this and encouraging other organizations around the state to help get the word out?
Sure. Well, first, I think it's really important about getting the word out, but then it's also important to just have vaccines close to where people live. So let me talk about first getting the word out. And it starts with conversations like these. And I really want to thank our partners across North Carolina, in our rural communities, in our faith communities that have been tremendous partners who are helping us spread the word. In fact, we have a campaign going on right now called Bringing Summer Back, where we're all coming together to raise awareness about vaccines. I'm sure you may have seen some of our public service announcements from everyone from Richard Petty in NASCAR to maybe someone in your community or your local faith leader. So you're seeing those advertisements on social media and radio, on TV. And we are working with partners. I think that has been such a key for us. And I want to thank all the partners who are getting information out to communities. Business leaders are doing it, education leaders, our elected officials, our faith leaders have been wonderful partnerships. But then we have to also make sure that vaccine is there for communities. And so what I would say is there are more than 3,000 locations where folks can get vaccines across North Carolina. We've done sort of a mapping of that, and we know that nearly everyone in North Carolina can get vaccine within 5 to 6 miles of their home, which is great news. And not only that, is that it's getting close to them. So we want to make sure you know that you go to myspot.nc.gov to look for vaccine close to you. We are also working to get vaccines even more mobile. I think Onslow County, for example, was just recognized for their innovative approach, taking vaccines to our farm workers, for example, which is great. But there's also a lot of partnerships to help with transportation. So Uber and Lyft, where they are running in our state, offering free rides. Our partners in local transportation departments are providing free rides to and from. And actually, we just launched a program this week in just a couple of counties. So we launched it in Mecklenburg, Rowan, Guilford, and Rockingham, where we're offering a $25 summer cash card, not just for people who come to get vaccinated, but for anyone who drives someone, because we reckon this is a team sport, right? Getting everyone vaccinated. So we wanted to recognize that we need everyone to help. If you've gotten vaccinated already, maybe driving a friend, maybe driving a member of your church to get vaccinated. What a wonderful a good neighborly deed that you can help our community do as we go forward.
Absolutely. And what sounds better than bringing back summer, right?
Let's do it.
That's right. Before I go to Patrick, let me just give one more call out for folks to take a moment to respond to our poll question. We want you to share with us your plans on the poll for getting the COVID-19 vaccine. So just take a moment. If you can do it on your phone, you can do it on social media in the comments. Just please, everyone, take a moment because we want to hear your feedback as we keep the conversation going. So, Mr. Woody, let me come to you and talk a little bit. Let's dive a little deeper into this conversation around rural communities, building on Secretary Cohen's comments. Share with us a little so we have the background around how did COVID-19 affect rural communities as we've navigated this last year, almost year and a half. Share a little with us about that.
Well, I think that's a great question, and it really does highlight for us how every community is different. And so I really applaud the efforts of the department and Secretary Cohen to not take a one-size-fits-all approach to trying to solve for this pandemic, and really recognizing that different places are affected in different ways. And certainly, as I think back, 14 months ago, 12 months ago, I think early on there was this sense that this pandemic was a big city problem. We certainly see that this virus loves density. What we didn't know perhaps as well as we should have in the very beginning is that density means any place where two or more people are gathered.
Right.
And so it eventually made its way to our rural communities, but it did take it longer to get to those less densely populated areas. But when it did arrive, it really arrived with a vengeance. And there are some characteristics of our rural communities that made particular populations and particular locations kind of uniquely vulnerable here. And we certainly saw that played out. The first thing to know is that we already had a healthcare delivery system that in some places it was pretty strained. 63 of the 80 rural counties that we serve are classified as health professional shortage areas. And so that's the first thing to know, is that this pandemic, as it arrived and as people began to get sick and before there was a vaccine, it already stressed healthcare facilities, our hospitals, our community clinics, and other health delivery systems in our rural areas. And then, we have a lot of food agricultural production that happens in this state, a lot of farm workers, a lot of ag production facilities or food manufacturing. The characteristics of a lot of people working in pretty confined spaces led to outbreaks in those particular areas. So we learned pretty quickly that we had vulnerable populations around food production and around our farm workers. Our population skews older, and we have a lot of older citizens that live in congregate care facilities. Again, a place of greater density and a place particularly vulnerable with residents who were particularly vulnerable. We also, a lot of, you look at the prison system of North Carolina, and we have a lot of rural prisons, again, densely populated facilities that were also particularly vulnerable to the outbreak of this disease. And not only do you have the people that live in nursing homes or prisoners in congregate living, but you have the workforce that serves them going back into community. And with that, we saw at times some of our rural counties where the infection rate was the highest. And so rural was not spared at all in this pandemic. And that's been of great concern to us, because in some ways we have less capacity to deal with that.
Thank you for that. Bishop Leland, before I come to you, I'm hearing that we are getting quite a few questions from our callers coming in. So I want to pause and ask for one of our callers to go ahead and say their name and ask their question.
Hello.
Hello, you are live and ready to go.
Okay, my question was, a couple of weeks after receiving my first injection, I was talking with my friend, and we both feel that there are more side effects to the vaccine, where you wake up in the morning and you don't quite feel yourself, almost like you're coming down with something, and you lose your appetite. Are these really side effects, or is this just a psychological game on our part?
Thank you for your question. Dr. Cohen, let me come to you on that one.
Sure. So we know that the vast majority of folks get very temporary side effects. I will share what I got from my vaccination, which was a sore arm, feeling a little run down. Certainly that first night, some people will get a little bit of a fever. Usually that is something that is time limited, 24 hours. So that is general 24 to 48 hours is generally the time in which we are seeing side effects. I will say things outside that window are probably very unlikely to be related to the vaccine itself. I think we all have aches and pains. My neck is certainly hurting me these days from hunching over my computer too long. So I don't know if that what you're feeling is directly related to the vaccine. Always get in touch with your healthcare professional. Make sure they're hearing those things from you. And if they feel like it's something they need to escalate, we do want folks reporting if they're having some side effects. There is a way we track all of that. We send all of that information up to the CDC for them to analyze and track. But I will say, if you had come to my office as a doctor, I'd say probably not. It doesn't sound related to the vaccine. Let's keep watching it. If it has something ongoing, maybe we'd explore further. But again, most people are getting just reactions within the first 24 to 48 hours, usually very mild, and often it will be after the second vaccination, not necessarily the first. And I want to remind folks, when you are having those reactions, it means your body's learning how to fight off COVID. So it's actually a good thing that your body's building its immunity, which is exactly what we want. So when you feel a little run down, it's because your body's learning. It's getting those instructions on how to recognize COVID. That's what the vaccine is. It's injecting into you instructions for your body to recognize COVID if you encounter it going forward. And so when you feel a little run down, it's your body learning, which is actually a really good thing.
That is a really helpful way to understand the side effects you might be feeling from that shot over the next 24 hours. Thank you for that. I want to remind everyone listening, if you have a question for our panelists, just press 0 and you'll be prompted to leave your question. But I want us to take one more question, and we're getting quite a few in. So let's open up to another caller. Maybe if you'll just tell us your name and where you're from. Question.
Hi, this is Amy Woods. I was calling in because I have had 3 major reactions. I'm listed with adverse reactions because in the past I've had 3 anaphylactic reactions from regular vaccines. I have a son that's had 2 major reactions, and I've had a sister that died from regular vaccines because of a genetic condition. And I believe we had the actual virus back in December of 19. But they're saying it wasn't here that early, but we've been exposed to other people and have had no symptoms beyond that. The last time I'd even had a sign of a cold was back when they had SARS went through. Mm-hmm. And I wanted to know if you're going to have any antibody testings in Lumberton for people that may have had the virus and have antibodies and that possibly can't get the vaccine because of adverse reactions to other vaccines in the past. Plus, I also have leukemia.
Oh, I'm so sorry to hear that. Let me send your question to Dr. Cohen to make sure we get you the right answers.
Sure. Well, there's a lot going on there. So let me tease apart. First, always when, for any vaccine that you are going to take, if you have had a severe allergic reaction to a prior vaccine, you should be having a conversation with your physician. But again, what we have seen is very, very vanishingly rare that someone actually has an allergic reaction to any of the vaccines. It is possible, which is why you want to have conversation with your doctor. And in fact, we always have a 15-minute waiting period for everyone who gets vaccinated to make sure we are watching for any sort of allergic reaction. But again, incredibly rare, but good to have a conversation with your doctor about it. What I wanted to share about folks who have had COVID before, we still very much recommend that you get the vaccine. And here is why. When you get COVID naturally from someone else, your body does fight off COVID. But it's not the same as the really effective way in which vaccines train your body, as I was just talking about, to recognize and then fight off COVID in the future. The vaccines are specific to giving your body instructions on how to recognize COVID in a way that is very, very effective, and we're seeing works really, really well. So even if you have had COVID in the past, sometimes that doesn't build your immunity in the same way that getting a vaccine would do. And so we very much recommend that you still get vaccinated, even if you've had COVID before, because it helps your body build that immunity in a really strong way. And we have heard folks get COVID again, and we don't want to see that happen. We want you to be protected. So again, have conversations with your doctor about past allergies. Very, very rare for that to happen, but good to have that conversation. And if you've had COVID before, definitely still recommend that you do get vaccinated. Thanks for the question.
Perfect. Thank you. Well, let me come to Bishop Leland. Bishop Leland, I want to talk a little bit about the faith community and what you're seeing. So I think the first question I have for you is around what are the opportunities and challenges that you've seen for the faith communities that you're working with and ministering to in terms of getting vaccinated? And then maybe talk a little bit about why the Western North Carolina Conference of the United Methodist Church is encouraging vaccination among its members.
Well, first I would say that we just had an example of some of the barriers that people feel that create a hesitancy to be vaccinated, or even some resistance to being vaccinated. For the most part, the hesitancy or resistances are the same in the faith community as they are for the general population. Worry over the complications or side effects, we hear about that. We hear about questions related to the safety of the vaccine. Some people will raise questions about long-term effects of the vaccine or whether it's as effective as it's reported to be. And then there are these practical issues that cause some people to be hesitant or resistant, and that's related to transportation and distribution concerns. Occasionally, we do bump into people who have misinformation about the vaccine and the virus. And we've tried to be in places where we could create conversations to give more or link them to people that have more information. But the Western North Carolina Conference, the churches there are encouraging vaccination because the most obvious reason for people of faith is that this is a very clear and specific way for us to live out the religious principle of just loving my neighbors. But on a larger scale, we can see a strong relationship between increased vaccinations and seeing a decrease in the number of new cases, a decrease in the number of hospitalizations, a decrease in the number of deaths. So we're contributing to the health and the welfare of our community by encouraging the vaccinations.
Right.
We're trying to get that word out as much as possible. I would say that our efforts have included direct encouragement by clergy leaders. We know that when people talk to persons that they trust, either family members or people that are close to them, which include many of the clergy leaders, they're more likely to think about vaccination rather than being hesitant. Offering our church buildings for information and vaccination sites. And of course, sharing information through the various media resources, which include stories of how and why our churches are involved.
That's really helpful. Thank you for sharing that really important perspective and looking at how the faith community is playing such a big role in encouraging vaccinations. I did want to go back to our poll question for those of you out there who responded. I want to share the answers with you. We asked you if you plan to get the COVID-19 vaccine, if you already haven't received it. And here are the responses. 39% of listeners say they have already been vaccinated. So that is wonderful. 23% say they do not plan to get vaccinated. 18% say they are unsure about their plans. And 21% say they don't plan to get vaccinated. So sounds like, Dr. Cohen, we have some mixed reviews there. Anything that you would say in response to those percentages, Dr. Cohen, as you see them come up?
Well, just to correct, I want to say 23% say they do plan to get vaccinated,
right.
which is
Sorry about that.
Which is great.
Yes,
and I want to make sure folks know how to access a vaccine. So what I would do if you're thinking about getting vaccinated and you're looking for where can I get vaccinated close to me? If you have access to the internet, go to myspot.nc.gov and they can help find you something close to you. And I want to read you our phone number again because you can also call our call center and they can also direct you to a vaccine provider near you. It's 888-675-4567. What I'd also say, if there is a Walgreens, a Walmart, a CVS, a Harris Teeter, a Publix, any of those that have a pharmacy, they are doing walk-ins for appointments right now. So if you're near those that might be on your way to work, on your way home from work, think about a local pharmacy near you. Call up your doctor's office, see if they're offering vaccine. Maybe if you have a few more questions you want to get answered, perfect opportunity to ask your questions and get vaccine. Or again, myspot.nc.gov. It could help you find something close to home, close to work. Maybe a friend can drive you. If you happen to be in some of the counties that are offering free rides, great opportunity to take advantage of those. So what I would say is, like, there's a lot of folks on the line who are saying, I want to get vaccinated, and that's awesome. Go for it. And hope that this is giving you some tools to make the commitment, make the plan right now. Like, decide what day you're going to go, put it on your calendar, mental note. I'm going to go tomorrow, or I'm going to go Friday and get it done. There's also a lot of events, and I want to really thank Bishop Leland for example, hosting a vaccine event at his church. I know that's happening at churches all over the place. So maybe even dial up your church community, see if they're hosting a vaccine event. If they're not, maybe it'll encourage them to do it. For those who are not sure, Kelly, I want to make sure that we are answering questions. I want folks to know the data and the science, because I have the opportunity to look at that data and the science a lot. I want to make sure folks know that these vaccines have been tested, that we have vaccinated more than 130 million people with these vaccines in the United States fully, and that's incredible, right? So this isn't any sort of small number of people here. It's really a large number of people who have gotten this vaccine. I'm sure I'd love to hear Patrick, I know, has gotten his vaccine. Maybe we can share our own stories about getting vaccinated, because I think that's really important for you to hear directly from us. Like, how did it go for us getting vaccinated? So I'm hoping to convince those folks who are not sure yet that they can get a free, safe, and effective vaccine.
That's wonderful. So Patrick, let me just ask you, did you get vaccinated? Have you been vaccinated? And if so, how did it go?
Absolutely, I've been vaccinated. And I was awaited for my turn in line, and then was very ready and willing to get in line. Interestingly enough, I live in Cary, work in Raleigh, but home will always be Allegheny County. And so I signed up in multiple locations, and I got my shot first in Allegheny County. Appalachian Health, the district health department that serves northwestern North Carolina, incredibly well organized effort that was very easy for folks to go through the process, very efficient. My mom, who's 82 and lives there, got her vaccine in late January. Did not have to get out of her car in order to do it, and had a very good experience. My own personal experience was pretty much what Secretary Cohen described. After the second vaccine, I really thought my right arm was going to fall off for about 24 hours. But I got over that pretty quickly. I really didn't feel bad, but I've talked to many people, and many of our employees here at the Rural Center. Everybody has a unique and different story to tell. And it's good that we share those stories, because I think it helps put other people at ease that maybe do have some concerns about getting the vaccine.
Well, Patrick, let me follow up with you on with another question related to that we're getting on the chat. What would you say to those who feel that they're not at risk for COVID-19, so they're choosing not to get vaccinated? I would really just urge everybody not to be complacent with this. We've made remarkable progress. The infection rates are coming down. Hospitalizations are coming down. We cannot get complacent with this, or we can slip back to a place where none of us want to be. And I do think that it's really important that people think about, we all want to get back to normal. We're all tired of this. We're tired of not being with family, not going on vacations, not doing the things we want to do, seeing the people we want to see. We want the economy back functioning. We want people economically to recover. Not everyone has suffered equally during this pandemic, but we know that we have some recovery to do from an economic point of view. Vaccination is our pathway back. It is our pathway back to a full economy and to a full life. And it's really important that we get those numbers up, and that we get our whole population where they need to be in terms of vaccinations. And that's not to downplay the very real concerns that people may have. And if they have concerns and they have questions, they deserve answers to those questions. Right.
And I encourage them to seek them from professionals who can give them the really sound advice and can help answer their concerns, answer their questions.
Right. Secretary Cohen, let me come to you, and then Bishop Leland, I'm coming to you to hear about your experience with the vaccine. But Secretary Cohen, we're getting a question from a Facebook viewer that I think we should direct your way. The question is, why take the vaccine if you can still get and spread COVID?
I'm really glad to get that question, because the answer is vaccines do protect you from both getting COVID and giving COVID to others. And the reason the governor and I were feeling confident about taking away the mask mandate and that we were eliminated any of the ongoing restrictions is that what the research shows is that vaccines work. They work at protecting you from COVID, and the new piece of information, they work at preventing you from giving COVID to others, right? So we know that now from the science. Now, look, nothing in life is ever 100%, neither is this vaccine. Is there a small possibility that even with a vaccine, you could get COVID? Yes. but it is very, very rare. And the way you protect yourself from COVID, way you protect yourself from getting into the hospital or unfortunately having the worst outcome, which is death. We have we've had more than 13,000 people die in North Carolina from this, and we don't want to see one more, right? So get the vaccine now because it protects you, but importantly also protects you from giving it to others who could be more vulnerable or more frail or get worse impacts from COVID, right? Because I hear from younger folks who say like, all right, so I'll get COVID, I'll get over it. Well, one, I would say young people are getting COVID and getting impacts of it. I've had a lot of friends who have had like their teenagers get it and they've lost their sense of smell and it's not back yet. That is not fun. I don't want to see that for anyone. So there are real side effects from this that can go on into the future. So we need to protect everyone, but it's also our young people interact with the community. They go to church and see their, older adults who are at higher risk for bad outcomes from COVID. So it is about protecting ourselves, but it's also protecting others. And it does do both of those. So the vaccines work on both fronts.
Thank you for that. Very helpful. I want to open up another poll for our viewers out there. So the question that we're going to put in front of you, and this kind of tags into the conversation we're having, if you haven't been vaccinated yet, what is the main reason as to why? And if you're joining us by phone, you can press your answer into the keypad. So you can press 1 if you haven't been vaccinated because you don't know how or where to get the vaccine. Press 2 if you don't have transportation to help get you to an appointment or place with walk-ins. Press 3 if you haven't had the time to get vaccinated or have been too busy. And press 4 if you plan to wait to see what others' experiences are with the vaccine before you get vaccinated. And you can press 5 if there's another reason that you haven't been vaccinated. And for those of you who are watching on social media, feel free to type your answers into the comment box, and we will share those results in just a few minutes. Bishop Leland, let me come to you. And really the same question, share with us your experience with getting the vaccine. Well, first, let me say, have you had the vaccine? And then share your experience with all of us.
Oh, yes, I've been vaccinated. I couldn't wait to be vaccinated. I'm at retirement age. And I didn't know how this virus might impact me or how it might impact my family. And I had a good friend of mine, Gary Wayne Locklear from Lumberton, North Carolina, who died of COVID. While it's true that not everyone infected will die, and we certainly grieve with those families that have lost their loved ones during this pandemic, but some people, through no fault of their own, have had unbelievable medical expenses and long side effects. And so I couldn't wait to be vaccinated. And I went ahead and got vaccinated as quickly as I could work out arrangements to do so. My experience was not a bad experience at all. I had a Moderna vaccine, 2 shots. The first shot, I had no side effects or any concern at all. With the second shot, I didn't have any of the experiences that most people have, with the exception of I had about 2 hours where I had kind of a spike of a low-grade fever, but within a few hours it was gone. And I was one of these fortunate people that really had no side effects at all. So that was my experience, but
yes.
I had a very, very open attitude to getting the vaccine.
Well, I'm glad to hear your experience went well. I will tell, in similar fashion to Patrick, the first thing I did was make sure my parents who were in Johnston County got vaccinated, and that went very well. And then made sure my husband, who is a teacher, got his vaccine. So I'm really pleased that went well. I would love to open up to another caller. We have a caller for Bishop Leland to ask a question. Hello, welcome.
Yes, hello. I'm in the southern counties, and I'm also sorry about the passing of Gary Locklear. But I live in Scotland County, and I work in Robeson County. and I'm active in the Methodist Church and other faith outreach in the counties. And what I have noticed is that the people, there are segments of the faith-based community who see wearing the mask earlier and getting vaccinated as an indication of a lack of faith or lack of trust in God. And so I thought the bishop maybe could reach out to the counterparts in the Eastern Conference and in the southern rural, very rural counties where we don't have the media that the cities have, to encourage the preachers and pastors as the ones who have to explain that that's not a test.
Thank you for that. Bishop Leland?
Yes, that's certainly one of the conversations that we occasionally bump into, where people express their desire to be a person of faith and to have no fear, or a person that puts more emphasis on personal freedom. One of the things that helped me was to look at the religious diversity across the country, and realize that this is not an issue that is contained just to the Christian faith, but other faith groups as well are working through similar experiences. But for the most part, all faith groups tend to abide by the guidelines of the CDC, the Center for Disease Control, and the state guidelines. They've tried to be careful about the distancing, to wear masks, and to be patient. So while we do occasionally see that in certain areas, that's not the prevalent attitude of the church.
Thank you for that. I appreciate it. Let's take another caller. We have several callers in queue, which is wonderful. And just a reminder, if you're listening and would like to get in the queue to ask a question, just press 0 on your phone and that will get you in line. Let's take another caller. Hello, can you tell us your name and where you are? Hello? Don't think we have a caller there. I've never been on live TV before. This is pretty exciting. All right, well, let's go to a question since we don't have our caller there. Secretary Cohen, I have a question for you, and maybe this is relevant to the caller having some challenges. Some members of the rural communities and some of our low-income communities may not have access to the internet. That's something that we've talked about, and we saw it in some of the governor's recommendations with American Rescue Dollars, the importance of broadband. What are some ways they can find reliable information and access to vaccine appointments?
Well, we know that continues to be a challenge. And what I would say is you don't need to have access to the internet. I first want to give you the phone number that you can call once again if you need any assistance finding a local vaccine provider. You can call 888-675-4567, and someone will be able to direct you to a provider in your area. If you're looking to get your teenager vaccinated, those who are 12 to 17, remember you want to find someone who has the Pfizer vaccine. So that's one very just practical. But in the big picture, we know that we need to have broadband access across this state. I will say as a doctor and healthcare professional, we need the broadband infrastructure so that we can reach all communities with healthcare access, but it's bigger than healthcare. It's economic. It's our ability to communicate with each other. That's why the governor year over year continues to invest in broadband and has one of the largest broadband investment plans in his budget. I think we're going to be able to make a lot of steps forward in broadband. I know that Patrick in particular has been working on this and thinking about this issue. So I'll turn it over to him to say more about the needs there.
Wonderful.
Well, several things on the broadband front. And my good friend Dan Gerlach once accused me of not being able to complete a sentence without using the word broadband. And that's almost true. But one was the response. So families have really struggled as kids were at home learning, and people were trying to avoid going to the doctor and maybe wanting to use a telehealth app, but didn't have the internet service they needed. The internet service providers, or the ISPs across the state, really did a great job of standing up hotspots and putting into place really what are not intended to be permanent measures, but temporary solutions that help everybody have access to better connectivity and to free connectivity. So hats off to the ISPs for the way they stepped up and really filled that role. Secondly, as we move forward, I mean, the pandemic has told us anything, it is the necessity of broadband in every community in this state and having access to it, being able to afford that access to it. Incredibly important. And I do believe we're at a moment in time where, thanks to the federal resources that are available for the issue, the way the state can use those federal resources and perhaps add some resources of its own, and the ability of local governments to also support that, we have an ability to solve this problem in a way that we have never had before. And I hope we use this moment in time wisely. I hope we get the legislation over the line in the General Assembly that we need to in order to do that. We are looking at unprecedented levels of investment to really get that last mile connectivity to every home and every business in rural North Carolina and in urban and suburban North Carolina, because there's pockets of unserved throughout the entire state. Also want people to be aware that there is an emergency broadband program that's available, and they should check with their internet service provider to see if that provider offers that emergency broadband program, which will pay a stipend, an amount to the homeowner for service and help them pay for that connectivity during for a period of time during this pandemic. And that's a great opportunity to take advantage of as well.
Wonderful. I want to open it back up to another caller. We have several in queue. Let's try it again. Do we have a caller there? Hello? Hi.
Hello.
Hi. What's your question? You're live on the air.
Yes. I'm live on the air, right?
Yes, you are.
Okay. My name is Dr. Ada Powell. I've been listening to your conversation, and this is for Dr. Coven and anyone else that wants to answer the question I have. Right now, you're saying to me as a healthcare provider that we have approximately 46% of the people either absolutely not going to take the vaccine, what you say, 18% are still thinking about it. Now, the goal I understand is trying to reach 75% herd immunity. We're dealing with the equal opportunity killer here. And all the discussion out here so far is not going to reach the area that I do my pro bono medicine in, this rural area. So what are we going to do as healthcare professionals and the state to persuade that 46%, which in turn is affecting that 75% of herd immunity? What are we going to do? Because availability of the vaccine is not going to do it. I got patients that come up with all kind of weird stuff. If they won't take the flu shot, why are they going to take this vaccine? So I'm asking the questioning, when are we going to have some innovative ideas to actually get these folks that are absolutely not going to take it, are standing on the borderline? Because if you subtract this 46% from 100%, we're in a world of trouble in the state of North Carolina when it comes to herd immunity.
It's a very fair and important question that you're asking. Let me go to Secretary Cohen and then welcome Patrick or Bishop Leland to weigh in as well. Secretary Cohen?
Yeah, no, I think it's a fantastic point, and it's exactly the reason we're having this conversation tonight. It's only one way in which we are trying to help answer questions. I think there are definitely folks who it hasn't been convenient, right? It hasn't fit into their schedule yet. Things have been, they haven't been able to get an appointment. I'm hoping we're helping to help them navigate to find an appointment soon, commit to that for this week. I think there are folks that have a lot of questions, and I hope that tonight we're answering some of those questions about, well, what are the side effects and where do I get it? Is it free? Am I going to have to pay for it? So I'm hoping we can answer those questions. I really appreciated, for example, Bishop Leland weighing in on the question of faith. How does your faith interact with you thinking about vaccination? So I hope all of that will help. But we need all hands on deck, and we welcome creative ideas. So I mentioned one creative idea that we're trying this week in 4 counties, where we're offering a $25 summer cash card. Because look, we know it's going to take gas money to get to this, or time off from work, and we want to respect people's time that they are taking to get the vaccine. So we're hopeful maybe that can help just make things just a little more affordable and a little more convenient for folks. That's not going to be everywhere. Some places are doing fun things like raffling off a car. So, find out what's happening in your corner of the community, or organize it yourself. Join us on the Bringing Summer Back campaign. If you sign up for that campaign with us, we can actually send you a lot of materials, flyers, sunglasses, lots of materials that can just help get the word out. Or maybe you want to partner to host a vaccine event like Bishop Leland was talking about. So I think there's a lot of ways, and I think this is an all hands on deck kind of moment. And I think our rural communities have always pulled together during hard times. And I think this is another moment for that. One last thing that I'll mention is that, we are able to look at our data and really understand where are vaccines not happening and where do they need to happen. So we identified zip codes where we were really seeing low levels of vaccine uptake and not a lot of vaccine providers. And so we literally were making calls to doctors' offices, to pharmacists to say, hey, did you know that your community could really use another? And what we've seen is they've answered the call. They're like, oh, we didn't know. We'd be happy to do that. They jump on board. And in fact, we're seeing vaccines increase greatly in those areas. So I think it is like a constant effort of talking about it, getting our vaccine providers to be creative with our communities. And it's just us all working together.
Wonderful. Thank you. And we only have a few minutes left of our conversation tonight. I am going to share the poll results in just a second. But Bishop Leland, let me come to you for we have just a few minutes. Can you maybe share with us just a few closing remarks, what you would want our listeners and viewers to remember as we go forward out of this important conversation tonight?
Well, several things. One would be, I hear occasionally a question about, can we trust the science of this vaccine and the vaccination? And I would remind us that we've always trusted the medical community to provide vaccines for many things. And we trust many, many other kinds of vaccines that have been very beneficial to us. And we're going to be able to trust this vaccine as well. Secondly, there seems to be a concern that because there are sections of the state where the new cases are low, hospitalizations are lower, people wonder whether they need to be vaccinated. And I would just remind us that regardless of the size or population of your area, when I visit the Haywood County, for example, west of Asheville, I noticed that there are cars from Maryland, Tennessee, Georgia, South Carolina, all have come to see the beautiful mountains of North Carolina. People gather even in these rural areas for weddings, for funerals, for family emergencies, and we're in contact with other people. And so if you're going to do this, one of the things you might think about is doing it for the children because they're not being vaccinated. But to do the best thing that we can, we have the knowledge to take the best step to protect ourselves and to protect our loved ones and to protect others.
Thank you for that. Very powerful. Let me just mention our poll results. I appreciate everyone taking them. The question had been, if you haven't been vaccinated yet, what is the main reason why? We had 19% say they haven't been vaccinated because they don't know how or where to get the vaccine. Secretary Cohen, can you share the phone number one more time? Sorry to put you on the spot.
Absolutely. Well, there's two ways. First, you can go to myspot.nc.gov or you can call 888-675-4567.
Wonderful. We have here 6% said they haven't had the time to get vaccinated or have been too busy. Back to you, Secretary Cohen. Remind everybody about the transportation, the rides to get to a vaccine to make it.
Absolutely. And there's a lot of walk-ins. So you maybe what fits into your schedule is maybe going to CVS or Walgreens or Walmart near you, one of the pharmacies or Publix or Harris Teeter. That might be right to fit into your schedule and you can just walk in.
Wonderful. 31% of you say you plan to wait to see how others' experiences are with the vaccine before choosing to get vaccinated. And Dr. Cohen, I would think maybe that's a call for all of us that have been vaccinated to share our message with our friends and family to help encourage others.
Yes, I think you heard Bishop Leland's story, Patrick's story, my story, your story, Kelly. So I hope that has helped, but I hope you're talking to your friends and family about their experiences and you'll go get vaccinated as soon as you can.
And our last one, 41% say that you have other reasons and you may not have referenced them. Dr. Cohen, I would say that to your point that the department, your team is open to any all ideas. And so making sure to share feedback where you can if there are certain things that maybe we haven't started to talk about around reasons why you haven't gotten it.
We welcome that.
Absolutely. Patrick, briefly, any closing remarks on your end? We're at time, but anything you would just say to close
just
out?
Really quickly, two thoughts as we wrap up. One, to the last caller who I think asked a very important question. What are we going to do? There's no question but what the easy part has been done with vaccination. So what we have left is hard work. Yeah. But we need to reach rural grassroots leaders and rural people and equip them with the information they need to go out and really into their community and reach their community. And the answer to his question is we're going to do whatever it takes to get us over the line with vaccination. And then just to remind everyone, we all are tired of this. We all want to get back to a full and rich life and enjoying family and friends. And the pathway back to that full life is vaccination.
Thank you for that, Patrick. We've come to end our time. Dr. Cohen, I'll flip it back to you. Thank you for the opportunity to be here. I hope everyone has found the conversation helpful. And
great.
Dr.
Kelly, you were a wonderful moderator, taking live questions, very brave. Patrick, Woody, and Bishop Leland, thank you both for your time. And what wonderful questions. I really appreciated everyone sharing their concerns. I think that's how we move forward together. When you can share those concerns, we can answer questions, we can talk it out together and move forward. myspot.nc.gov, 888, I'm going to give a phone number one more time, 888-675-4567. Please get vaccinated as soon as you can with a free, safe, and effective vaccine. Stay well, everybody.
Thank you.